The main concepts of this chapter is to look at the history of occupational therapy and its roots in philosophy and health promotion. We're first going to look at the historical and cultural views of health and health promotion. So civilizations across the world have contributed to the development and beliefs and ideas about health and wellness. Across different societies, those who practice medicine were typically more highly respected than those who focused on prevention. This was especially seen in the Greeks. Indigenous American populations, however, saw the link between hygiene and illness, and therefore a need to prevent disease, but through the way that they lived. Various Chinese and Indian influences are also attributed to the beliefs about health prevention and promotion. So, as you can see, a variety of people across the world have had ideas about medicine and how we can prevent disease from happening instead of just treating it. So, next we're going to look at the historical use of occupation and using it to promote healing and wellness. So the use of occupation has been used across history to promote health and well-being. So for example, Egyptians and Chinese prescribed physical activity to restore well-being. Occupational balance has also been seen as a link between health and well-being. For example, Hippocrates, who was a Greek doctor, encouraged physicians to examine a patient's what he called mode of life, which include their habits like drinking or smoking, how much physical activity they engaged in, as well as their job and the things they were exposed to. The link between occupational participation, health, and overall wellness has been seen all over the world since the beginning of medicine, and these ideas still influence the way we practice today. So there's been some important historical milestones that have attributed to how occupational therapy is practiced. The first is the birth of our profession. So the birth of our profession comes from the idea of moral treatment. It provided the foundation of ideas that would be embraced by the founders of occupational therapy. Moral treatment is an approach to treatment for those with mental illnesses that centered around productive, creative, and recreational occupations. So those values were supported by OT's engagement in health promotion. So basically it was looking at those who had mental illness and getting them involved in things, which then in turn promoted their health overall. People were also beginning to provide themselves or realize that their own participation in occupation also contributed to their health. So through time, individuals and communities have self-prescribed occupation to heal and prevent illness. For example, Winston Churchill pursued a variety of occupations, including military, political, and public service. And Winston Churchill was extremely successful and won a variety of awards, which can all be linked to his participation in a variety of occupations. So occupational therapy has a large root in military practice, especially in World War I. So military leaders have long recognized the benefits of using occupation and improving their armies, including physical activity, for conditioning and prevention of injury. Occupation has also been used to rehabilitate soldiers since World War I. Occupational therapy was shown as an effective treatment for shell shock in particular. So some early community and prevention practice has been seen as well. The earliest example of a community-based OT in the U.S. was the opening of the Consolation House. So the Consolation House was a place for patients who had been previously held in a sanitarium, and it provided them with occupations to engage in, as well as clean and hygienic areas and people that were practicing moral treatment in their treatment of the patients. OT has been used to promote prevention for infectious disease and to promote child development and the prevention of late criminal behavior throughout history. So some visionary leaders have been behind our profession and the idea that OT can be used as not just a treatment, but also a preventative. Weiner was the very first OT to have this idea that OT could play a role in preventative medicine. So she stressed that OT's view and their role in prevention was limited. So she encouraged practitioners to expand their efforts across preventative healthcare as well. So in the 80s, many people have published articles on how OT could enhance development of age-appropriate skills and how OT could play a role in workplace injury prevention. The 80s is also when backpack awareness started, which was a way that OT directly impacted the community in order to prevent injury. So in the 1990s, Wilcock and Townsend articulated a vision on how OT would contribute to health and well-being at a societal level. They introduced the idea of occupational justice and injustice, as well as other terms that assisted practitioners in describing global issues through occupation. At the end of the 90s, the Well Elderly Study was published, which showed that preventative OT could greatly enhance health and quality of life for older individuals. This reinforced the fundamental ideals behind our practice.